In this next video, I am going to go over how to foam roll your quadriceps, your IT band, and the lower body. So you can go ahead and grab your roller. I like to start with the quadriceps, the four muscles on the front thigh. We're going to go ahead and start mid-belly, okay? We're going to push up into those elbows, keep that core tight, don't dip down, pull that up, and just start rolling, okay? Roll above to that kneecap. And then going all the way down, above to that hip joint. You can go back and forth. We're gonna do this for about 60 seconds. Stay on a spot, find that spot that feels a little extra sore. Hang out in there for a couple seconds, 5 seconds, 10 seconds. Roll back and forth. I don't like counting, so I just like putting a timer on and doing it. Also, you can't cheat time, so my patients use their timer, and that tends to work good. Okay, keep your core tight, back and forth, right above that kneecap. Now this one for the quadriceps, I think feels really good, okay? ITBand's the next one. I don't like, but we gotta do it. Any person that has knee injuries, if you're an athlete, you should be rolling once to twice a day, before and after. Okay, I say about 30 to 60 seconds on each major body area. Then we're going to do the IT bands. IT bands, I think, is the hardest one. I am going to do single leg, put the 1 foot in front, shoulder down on the elbow, okay, shoulder over the elbow, and then you're going to start rolling, okay? Now this is not comfortable, okay? It's my least favorite thing to do, but it is so good. And I can't even tell you how many people's knees and hips get better with rolling your IT band. For all my patients with knee issues, the first thing I try to get them to do is roll their IT bands because it just helps their knees a lot. Young athletes. Now you can do double leg, but I cannot. It's too much pressure. So if you can do double leg, all the power to you. Again, find that little spot that just feels really sore and just kind of sink into that. You may only be able to do like a second in the beginning or just not even stop there. That's okay. Just kind of roll. You can roll forward. You can roll a little backward. Okay. Pushing weight through that leg and through the arm is going to take the pressure off the IT band in those areas. Just roll back and forth to that hip joint, right? That bone that you feel up there, and then all the way down to that kneecap, forward and back over that kneecap. All right, then we're going to go and do the other side. So again, you can do double. I'm going to do single. I'm going to start about mid. Okay, foot in front, push down into the elbow. You can do up onto the hands as well and take the pressure off. Okay, I like doing on the elbow. Pull your core tight all the way down to above that knee. Roll forward and back on that distal IT band. Loosen that up, kind of, you can pick a spot, roll in there, go all the way through, pushing up there. I know it's not fun. Although some people love it. Some people can do double, and like I said, that's great for them. Okay, got a little bit left on here. Keeping that core in, raised up. Okay, good. All the way down. Side to side. A little bit in the front. Okay, good. Now the worst is over. Next, we're going to do hamstrings. Hamstrings, we're going to start mid-hands. Now I'm going to do both at the same time initially. And just roll it back and forth all the way up to that butt bone right there, that ischial tuberosity, where those hamstrings attach to. All the way down to the knee. Now we can do singles. Kind of rolling back and forth. Stay on one of those spots that feels extra tight. My hamstrings maybe feel pretty good. They're not too bad. My IT band, so hard for me. So do what you can. 30 to 60 seconds. You know, for athletes, you should be doing this every day. I also recommend trying for 3 to 5 times a week. Watch some TV, roll them out. Okay, we're almost done. Hamstrings. So I get a little spot right there in the middle. Just kind of feel into that. Okay. And then we're going to go do the lower body, like below the knee. So the calf complex, kind of sit right into that middle calf, push up into the shoulders, and hang out back and forth. You can bring your butt down to switch if you want. Roll down into that Achilles, pull those feet up, back and forth, and then you can roll up into those upper to mid calf. Okay, you got the gastroc, you got the soleus. Now you should roll those feet out. You get those lateral structures, those perineals. Okay, those are really tight. You can also do one leg at a time. If you just notice one spot's a little tighter than the other, just kind of put a little bit more love into that area. Go back and do both here. Down to that Achilles, up into that mid belly. Keep up into those shoulders, keep that core tight. We're almost done. You're doing good. And back and forth. Get a good arm workout too. Now with the rollers, this is actually kind of a little bit of a softer roll. I don't recommend the bumps. All the power to you if you can do the bumps, but I cannot. It's pretty tough for me to do the bumps. So the soft roller, remember, never into any bad pain or discomfort. Always stop if it doesn't feel right and contact your local PT and comment for any suggestions or questions. And I'll see you soon.